Hello and welcome. Today we'll be exploring coccidioidomycosis, a fungal infection often referred to as valley fever. This disease, while sometimes mild, can cause significant respiratory illness and, in rare cases, spread beyond the lungs. Join us as we delve into its causes, symptoms, diagnosis, and treatment. Coccidioidomycosis is caused by inhaling the spores of the fungi Coccidioides immitis or Coccidioides possidacea. These fungi reside in the soil in certain arid and semi-arid regions. When the soil is disturbed by activities like construction, farming, or even wind, the spores become airborne. These spores, called arthrochonidia, are incredibly small and easily inhaled, initiating the infection in the lungs. Once inhaled, the arthrochonidia settle in the lungs and undergo a remarkable transformation. They develop into spherules, large, thick, walled structures filled with endospores. When the spherule matures, it ruptures, releasing numerous endospores into the surrounding lung tissue. These endospores can then form new spherules, perpetuating the infection. The body's immune system attempts to contain the infection by forming granulomas, collections of immune cells that wall off the spherules. However, in some individuals, the immune response is insufficient, leading to more widespread infection. Coccidioidomycosis is primarily found in the southwestern United States, particularly in Arizona and California's San Joaquin Valley, hence the name valley fever. It also occurs in parts of Mexico, Central and South America. People who live in or travel to these areas are at risk. Certain occupations, such as construction workers, agricultural workers, and military personnel, have a higher risk due to increased exposure to disturbed soil. Climate change with its associated droughts and dust storms may be expanding the geographic range of the fungus. The symptoms of coccidioidomycosis can vary widely. Many people who are infected experience no symptoms at all. Others develop flu-like symptoms such as fatigue, cough, fever, chest pain, headache, and muscle aches. Some individuals may develop a skin rash, often consisting of painful, red bumps. In more severe cases, the infection can spread from the lungs to other parts of the body, including the skin, bones, joints, and brain, leading to more serious complications. Diagnosing coccidioidomycosis typically involves a combination of methods. A doctor will usually start with a physical exam and a review of your medical history, particularly focusing on travel history and potential exposure. Blood tests are crucial and look for antibodies against coccidioids. These tests can include an enzyme immunoassay or immunodiffusion. A chest X-ray or CT scan can reveal characteristic lung abnormalities, such as nodules or infiltrates. In some cases, a sample of sputum or tissue may be taken for culture to identify the fungus directly. Coccidioidomycosis presents in different forms, dictating the level of care necessary. Acute primary coccidioidomycosis is the initial infection, often self-limiting and resolves without treatment. Chronic progressive pulmonary coccidioidomycosis involves persistent lung infection, causing cavities and nodules. Disseminated coccidioidomycosis is the most severe form, where the infection spreads beyond the lungs to other organs, requiring aggressive treatment. Treatment for coccidioidomycosis depends on the severity of the infection. Many mild cases resolve on their own with rest and supportive care. However, more severe cases, particularly disseminated disease, require antifungal medications. Common antifungal drugs used to treat coccidioidomycosis include fluconazole, itraconazole, and voriconazole. Amphotericin B is used for severe infections. Treatment duration can range from several months to years, and regular monitoring is essential to assess the effectiveness of the treatment and watch for potential side effects. Preventing coccidioidomycosis entirely is difficult, especially for those living in endemic areas. However, certain measures can reduce the risk of exposure. During dry, dusty conditions, try to avoid activities that disturb the soil. If you must work in dusty environments, consider wearing a mask such as an N95 respirator. Wetting the soil before digging can help reduce the amount of airborne dust. Promptly treat any symptoms suggestive of coccidioidomycosis, especially if you live in or have traveled to an endemic area. The prognosis for coccidioidomycosis is generally good for those with mild to moderate infections. Many people recover fully without any long-term complications. However, the prognosis is more guarded for individuals with disseminated disease or those with weakened immune systems. Recent research is focused on developing more effective antifungal drugs and improving diagnostic methods. Scientists are also exploring the potential for a vaccine against coccidioidomycosis, which could offer long-term protection against this potentially debilitating disease. Thank you for joining us in learning about coccidioidomycosis.